there's an association of autoimmune hepatitis with fatty liver. So you want to exclude other conditions. And then for clinical trials are pediatric cases. But obviously, most patients don't require a liver biopsy. Next slide.
Yeah, that's wonderful, doctor. Hmm? So, yeah, one question to Dr. Sharad. A person has got a fatty liver radiologically with a normal liver enzymes, right? So, can we be able to reassure him that ignore the radiology report and live happily?
Yeah, I think I mentioned this already. So I'm looking at just going back to the same thing again. So there are three components: your radiology report, your liver function tests, and your metabolic profile. If it is only a matter of a radiological report of fatty liver, everything else is fine. Yeah, I think you can very confidently tell these people, they can be your friends, relatives, patients, that they are unlikely, very unlikely to have any liver related problems in future. That is subject to obviously a good lifestyle, not they're not indulging in alcohol, having a good lifestyle. So if those confounding variables are taken care of, I think they will not have an increased risk of liver events. But of course, life is not static, right? It is dynamic. Let's say that same person 5 years later becomes a diabetic.
True.
So some patients, fatty liver can be the index event. So they have fatty liver today, they have nothing today, but they are at an increased risk of developing diabetes. There is some new evidence coming out that before your blood dysglycemia sets in, you can have fatty liver as a harbinger of more metabolic issues to come in the future. But once again, that's not a message that we should go out with. It starts scaring the hell out of people. So as of now, yes, nothing. You don't need to do anything for that patient.
Sir.
I'd just like to add one more aspect of fatty liver, where it is not the number, of amount of fat or percentage of fat which is important in that individual. If you see a complex scenario like metabolic syndrome and fatty liver, only giving a number of fat fraction is not important, but the underlying fibrosis also is important. So ultimately, we are worried about the effect of fat leading to fibrosis. So in a